Okay, thank you very much. All right, just introducing myself. I'm John Webber. I'm a psychiatrist. Been working for over 30 years in private practice in Melbourne and Australia. And thank you to Wendy and Victor for inviting me along. It's lovely to get a chance to talk, and I do love talking about these topics. It really has been triggered by the book. That's the book, The Red Chair, that I wrote. And I'll talk a little bit about the journey that got me to writing that book, and some of the events that have happened in association with that. So what I'd do is just start by saying that I was one of those doctors, those psychiatrists that would have completely dismissed any talk of spiritual or psychic or metaphysical phenomenon. I just would have said it's just baloney. Always very attached to traditional medicine. Can you still see me okay? Good. To traditional medicine, and if modern science couldn't explain it, then it just had to be dismissed. And that was my history. That's how I saw it. And then about 12 years ago, I read a book which Len had talked about. I read a book called Many Lives, Many Masters by a psychiatrist, Brian Weiss. And I would never have normally read something like that, but my daughter brought it to me, and I promised her I'd read it. I've discovered that nothing's coincidence in this life. And it really had quite a profound impact on me. He was a well-credentialed psychiatrist, chairman of the Department of Psychiatry in Miami, who had a very difficult patient with physical and emotional problems. And while exploring his childhood under hypnosis, he said to her during the hypnosis, said, "Go back to when your problems began." And whammo, she then went back a couple of hundred years to a lifetime that related to one of her physical problems in this lifetime. And yeah, I'm sure a lot of you have read the book, but it was, for me, it was just quite compelling. It was written in a reasonable manner, and in the end, I just couldn't ignore it. And then around the same time, my son-in-law came to visit me, and Sam, and he'd had a difficult time. His brother had died about a year or so before, and he was still quite distressed, and his brother had left him a car in his will. And Sam just didn't know what to do with it because the car really was a wreck. It wasn't worth repairing, it wasn't worth looking after, but it had sentimental value. Now, his mum was a little bit spiritual, and she said, "Look, go off and see this medium. I mean, she's terrific." So Sam, against his better judgment, said, "Okay," I think to please his mum more than anything, went off to see this medium, and she sort of immediately started talking about this young man who was standing next to him, and started describing his personality, which was a little bit tricky, and he. And then after about 10 minutes, she said, "Now look, he's mentioning the car, and he's saying, 'Don't worry about the car. It's okay. Don't worry about the car.'" And for Sam, that was just quite remarkable, quite remarkable. And then about 10 minutes later, after again talking about a few events in his life, she said, "Oh, and now he's saying Tim or Timmy, and he's laughing, he's smiling. Does that make any sense to you?" And Sam said, "Well, yep. When I was younger, he and my other older brother used to tease me and call me Little Timmy." Now, I actually got to listen to the recording of that that interview. So for me, it was just quite compelling. So I began reading voraciously. More books by Brian Weiss. They were terrific. I love to tell the story. I often forget to tell this, but I love to tell the story that he told about a Chinese surgeon that came to see him, and she was desperate to do a regression, but she spoke no English. So she flew over to America. She brought an interpreter, and during the regression, she went into a past life, an English life, and she started speaking English fluently. What was fabulous was that the interpreter then started interpreting it back into Chinese. Brian did say, not required. I understand English. So it's a bit hilarious. But xenoglossia, which people talk about, that ability to suddenly talk a language that you've never spoken before. And I always love that story because there's something quite profound and spontaneous about that. Then I did other reading, Old Souls, written by a journalist who followed Ian Stevenson. Again, a lot of you will know about Ian Stevenson, a child psychiatrist. He's passed on now, but he did extraordinary work at the Virginia University and followed nearly 3,000 children who had talked about their past lives, children between the ages of 2.5 and 5. And he was scrupulous in his approach. If you read his work, it's actually quite tricky reading it because he's so careful in drawing conclusions. He'd interview the children, the families, investigating the past life that they spoke of. And in more than 100 cases, he was able to verify the past life that the child had remembered. And for me, that was just spectacular. And there were also little remarkable things like the fact that he discovered that some of the children had birthmarks that specifically corresponded to the cause of death in the previous life. The one that I always remember was the child who had a tan skin but had an area of depigmentation about the size of a coin in the middle of the chest. And when he was able to verify the past life, he discovered that lifetime had ended by an accidental gunshot wound to the chest. So things like that are very specific are just remarkable and difficult to ignore. He also had a couple of children that spoke a language or a dialect that the rest of the family just couldn't understand. And when he researched it, discovered that was the language, or the dialect was the language of the previous lifetime that the child had been talking about. So I read individual accounts of people's past lives. Jenny Kukel, Yesterday's Children, the story of James Leninger, Soul Survivor, and they were quite spectacular. And then I read all about near-death experiences, Jeffrey Long, Eben Alexander, Bruce Grayson, wonderful spiritual experiences. Now, I won't go into the detail of all of those. That would be, preaching to the converted. But they're quite spectacular. And for me, it was what are called the veridical near-death experiences, where people's consciousness has left their body and they're observing events or details that could not possibly have been observed from where their body was, let alone in an unconscious or dead state. Then I read up on other psychic phenomena, Dean Radin's work, to do with telepathy, telekinesis, remote viewing, precognition, fantastic again at Virginia University. And then mediums like Laura Lynn Jackson and John Edwards, and more recently, of course, we've got Tyler Henry. And of course, there are lots of other lovely mediums who are really good, like the one that my son-in-law, Sam, saw. And of course, there are charlatans as well, which complicate the process. But that's life here on Earth. So I really just didn't need any more convincing after I'd done all of that reading and research. And of course, I'd talking to patients and friends and started listening to their stories. And again, they were really difficult to ignore. But my interest was in reincarnation and the use of hypnosis and past life regressions, and to explore that and to see if that could have some benefit with my patients. Now, as it happens, I knew I had hypnosis skills, which is uncommon for, I'm not sure about America or elsewhere, but here in Australia, it's really the domain of psychologists. But I had those, so I polished up those skills, but I didn't want to apply it immediately to a patient. So I put the word out, and my wife's friend, Jenny, said she'd always been curious about the possibility of past life. So she agreed to be my guinea pig. And again, nothing's coincidence. She went into she was a really good hypnotic subject and would go into a deep trance. And over 6 sessions, we did 6 because we're enjoying it so much. She went back to numerous past lives, none of them famous, I might add, but still fascinating. I still haven't had anyone famous at this stage. And they, in her lives, included being a male in 13th century France, being abandoned as a newborn baby in Africa. That was a bit distressing for me, I have to say. A life in ancient Egypt, soldiering in a war between Athens and Sparta, a life as a merchant in China, where they were caught in a snowstorm and actually froze to death. And again, that was another one that was a little bit scary for me, because she literally started shivering while she was describing the events, and shivering in the chair. And that didn't stop until her memory of that lifetime ended. So what was interesting, and that's a good example, what was interesting was that during the hypnosis, Jenny was just completely embedded in the emotions, the observations, the details of the past life that she was remembering. There was no sense that it was imagined or contrived. And she would also go into, and that's where it was spectacular. She was my first client, if you like. But at the end of some of the lifetimes, she would then go and describe leaving her body and going into the spirit state or spirit realm. And she might, in that state, she then might connect with people who died in that previous lifetime, or make connections with spirit guides or wise beings. And so for me, it was just spectacular. Jenny loved it. She felt it had some great benefit for her. Some of her long-standing insecurities were she understood them better. And of course, I loved it as well. So I decided I could use it on a few patients if I felt it was appropriate. So my first two patients were patients who'd had near-death experiences. Now, often near-death experiences can be quite transformative for people. Unfortunately for these two women, it hadn't been, but they still remembered them very, very strongly. And therefore, both were interested in spiritual things. Both suffered from anxiety and depression, and were still on medication and receiving therapy. And in both cases, the regressions proved really helpful. And both, in the end, very quickly came off their medication. I'll give you an example. This is probably the closest I've had to what might be a verifiable near-death experience, or a verifiable past life during regression. With Jane, she went back into a lifetime where she described living in a really big house with great big white columns. And she spontaneously said, "It's America." She was in the veggie garden picking vegetables, but she said it was very, very hot. She was in a white dress from neck down to toes. And she then went inside. So she's describing actual events as she's in that hypnotic state. And she went inside, and the cook then told her off. She shouldn't be outside in that heat because she was pregnant. And I, at that stage, I asked, what was the date? And she said, "Oh, it's 1878. It just came to her like that. And she said, "I know it's that date because I'm turning 20 today. It's my birthday. That's why the cook's here. We're having a lovely party tonight. My brother's come to join in the party as well." So and again, I'm not quite sure why I did that, but I then said, "Well, where in America do you live?" And she said, and paused for a moment and said, "Cape May." Now, I have no idea where Cape May was. Now, some of you in America may well know that, but I didn't have a clue. And I'm sure people overseas as well wouldn't. And I thought, okay, fair enough. Anyway, I took her forward in that lifetime and said, "Go forward to the next important event." And she said, "Oh my goodness, there's been a terrible fire." And of course, I'm recounting these, but I've recorded all of these. So this is based on the recordings and the transcripts that I've written in these cases. So all of the cases I'll talk about have been recorded. And she said, "There's been this terrible fire, and it's burned down a lot of the town. We're lucky we live in a state outside of town, but a lot of our friends, their houses have been burnt down, their businesses have been destroyed. So we're trying to help them." And I went through the rest of that lifetime with her. It was a fairly normal lifetime. Her husband died from consumption. Her daughter grew up and married, and they then looked after the estate at Cape May. And when Jane came out of it, I said to her, "So do you know where Cape May is?" And she was not. She didn't have a big education. Jane probably left school when she was about 15, and had never left Australia. And she said, "Oh, look, if it still exists, I wouldn't have a clue." Anyway, so that was curious for me. So that I had a busy day that day, and that night we're having dinner with my brother and sister-in-law, and I was talking to them about the regression, and I said, the story, and my sister-in-law jumped up from the table and went over to the computer and typed in Cape May, and there it was in 1878 in Cape May. A third of the town was burnt down by a fire that was thought to be deliberately lit. So for me, that was pretty spectacular. It was for Jane as well. But in the end, that's as close as I've come to something that's verifiable. Now, my third patient was also a patient who'd had a near-death experience, and that's Judy. And Judy's the one that I talk a lot about in the book. I'd been seeing her for nearly 20 years. I started seeing Judy when she was 32. At the time she was married, she had a 6-year-old daughter. She'd seen other psychiatrists, had been hospitalised for her psychiatric problems. And I started seeing her after she'd taken a dangerous overdose. Now, Judy is really colourful. And if you get to read the book, you'll realise that she's quite a character, engaging and colourful. But she had the worst upbringing, just a terrible upbringing. She was the 7th of 8 children. And was badly abused by a number of her older brothers. And over the 20 years that I'd been seeing her, I'd been particularly unsuccessful in helping her. She'd had regular therapy, numerous hospitalisations, numerous medications. She'd had ECT, shock treatment, which again is a good treatment in the right circumstances. And she'd taken a number of very dangerous overdoses, and really, in truth, was lucky to be alive. She had what we call a complex post-traumatic stress disorder with periods of severe depression. So I thought, what the heck? She'd had a near-death experience, and I'll just describe that one briefly because it's fascinating. She had an illness called Guillain-Barré about 10 years earlier. And the Guillain-Barré, it's an autoimmune illness which causes paralysis of the muscles. And in her case, it paralysed the muscles to the extent that she was unable to breathe. So she ended up in ICU, on a respirator, in an induced coma. And while in that state, she floated out of the body up into the corner of the room, she said, and was looking back down on her body and seeing her chest rising and falling with the respirator. And she said it was lovely. She felt so peaceful and so calm. And then the gold light came over her left shoulder and said to her, "It's not your time. You have to go back. You have to look after the kids." Now, I didn't see her for 2 months because it took her that long to recover from the illness. But when she did come in, she said, "Look, he definitely," and she called him he, but she said he wasn't a he or a she, definitely said kids. And she said, "I can't have more kids. I've only got one child. I've had an endometrial ablation and I can't have any more." But she said, that didn't make sense. Anyway, her daughter at that stage was 16 and a year later was pregnant. And Judy was, for the rest of her time, she's still around, has been helping her daughter look after the kids, the grandkids. So I was a bit nervous. I started using hypnosis for her smoking and for her semi-regular heroin use. And in both cases, and again, nothing's coincidence, she was a great hypnotic subject, and she stopped using both of those. So I said, what the heck, we'll go ahead and do the past life regressions. And she went back into 2 female lives in America around the 1800s. And then in the third one we did, she went to a Frenchman. And I actually start the book with this because it's a little bit funny and it's a bit provocative. She went back to a life as a Frenchman, who eventually, it was a traumatic life, eventually got shot by German soldiers for hiding people under her floorboards. And it was traumatic because his wife and 2 children were shot as well by the soldiers because they'd been colluding. And I was a bit worried when she came out of it. I thought, oh my God, she's going to be I've traumatized her in addition by doing the past life. Now, that wasn't the case. When she came out of the hypnosis, she opened her eyes and looked over at me and said, "What the fuck?" She said, "You didn't tell me I could be male." And she said she had just literally presumed that she would, if she had past life, they'd be female. So that was always funny for me. She went into other past lives in Spain and England, and like Jenny, Judy would often go to the end of the life and describe leaving the body and that feeling of peace that would come over her, just very similar to people's descriptions of near-death experiences as well. And in that spirit state, that's what I call it. She would often meet up with other beings and family members who had died. And for her, and occasionally the guides or the beings, including that gold light, would give her advice with regard to her current life. I won't go into all of the details of that. You'll have to read the book. But for me, that was, and some of the advice actually turned out to be completely accurate and extraordinary. So I won't go into all of the details, but it had a wonderful positive effect on her. She even ended up being able to forgive her abusive brothers. She didn't want to have anything to do with them, I might add, but in her heart, she was able to forgive them, and that was quite lovely. And of course, we were able to reduce her medication. It really had a profound effect. And for more than 10 years now, she's not taken any overdoses, anything like that, and not required any psychiatric hospitalizations. So it's been quite lovely. And for Judy, the regressions, I think, I was trying to work out why were they so effective. I think they just gave her a sense that there's just more to life. There's just way more to us. There's life after death. There's past lives. There's possible future lives. And that our soul or our spirit is our true self. And that we're all connected in ways that we can't explain. So it had a lovely, profound effect on her, and I have to say on me as well. So I felt very fortunate. So I've continued to use past life regressions with patients when I think it will be helpful. I haven't had any negative outcomes, and I have to say that, which is for me is reassuring. I think if you're going to use anything therapeutically, the first rule is do no harm. But I really haven't. The only negative outcome, to be honest, is when people don't go into a past life and they're disappointed and frustrated because they want to do it. And I just say, right, do a bit more meditation, and we'll see where we go in the future. So I thought today, we haven't got a lot of time, and I really do. I can carry on and talk forever about these issues. I thought I'd talk about just what the positive outcomes that result, and give some examples of things that aren't in the book that I've done since I wrote the book. No, there's possibly one or two that are related to the book. And the first, why they have such a positive effect? And I think the first thing to say is that for some people, it just simply reduces or removes their fear of death. And that alone can be very powerful. For others in the same way, it just really helps them ease their grief with loved ones who've died. And that just, it really eases their sense of loss. And then for others, I think it's just simply that understanding that there is just much more to us than simply this body and this life. That our true self, our spirit, is something far greater. It really just takes the pressure off getting everything right in this lifetime, and that's certainly applied to me as well. So it's been quite lovely. Some people go into past lives that give them greater perspective on their current life. I saw a man just about a year ago, and Tony, and he went back into, and Tony's married with with three young children. He's busy working hard and paying off the mortgage, and and seeing life as very stressful. And he went back to a lifetime where he was a woman. Centuries ago, we worked that out because she saw knights every now and then would come through the town wearing their armor, but this lifetime that he went back to, she was incredibly poor. She'd lost her partner. She had two young children. They were in poverty. She struggled to feed the children and herself, and sometimes had to steal to feed them. And was always worried about the authorities catching up with her and the consequences of that. And it was tragic because the children died early in that lifetime, perhaps from infection, perhaps from malnutrition. She ended up dying, I think, in the late 30s, as she described it in the regression, which may well have been the normal life expectancy back then. But for Tony, when he came out of that lifetime, it was quite extraordinary for him, because he was able to suddenly get perspective on his current life. He went, "Oh my goodness, I just don't know what I'm worried about." Having experienced that past life, he went, "I'm so lucky. I've got healthy wife, healthy children. I'm healthy. I live in a lovely home. Life's okay." So it really had quite a lovely, profound effect, and helped to reduce his stresses and give him perspective. And for other patients, it helps to explain their fears or phobias in their current life. And Cassandra's a good example of that. Cassandra was one of those patients who was always a bit caught up with conspiracy theories and what the authorities were doing and what people were doing behind the scenes. And she could get quite paranoid and anxious about it. And she wanted to do a past life regression. So I thought, what the heck? And she went back to a lifetime where she was in England at the time the Romans invaded, a male life. So it must have, around 2,000 years ago, which is extraordinary. But she described the Romans appearing, and initially it was fantastic. They brought technology, they improved, a lot of the standard of living and the qualities of their life initially, and it was wonderful. But then the people in charge changed over. And the new person in charge was very powerful and despotic and cruel, and life became miserable and became very traumatic. So for me, with Cassandra, that was really lovely. So when she starts talking about her conspiracy theories, and we just quietly just say, well, no, hold on, it's not the Romans. All's well. Let's keep some perspective on that, and that's kind of been lovely. And in fact, for Cassandra, and this is important because she's done further reading as well. I love the ripple effect of these things, and she'll just now say, well, John, I kind of know that none of it's real anyway. This is all an illusion. And that just allows her to not get caught up in the stresses of her current life. So now, occasionally, with a past life, it relates to a physical problem that somehow has been brought through into this life through their reincarnation. I don't even start to try and explain how that happens, but sometimes that happens. And Charles was a patient who went back into a Japanese life, where he was clearly a very important leader. He described in the hypnosis a lifetime where he was, in his silken clothes, and he'd arrive in towns and there'd be people lined up to honour him. He might be the closest one to having someone that's famous, but my Japanese history isn't that good. And he was sitting in a grand chair or throne with monks all around him and people sitting around. And he had a temple, but his life ended when the temple was attacked and burnt down. And he described the stab wounds and then the blacks and blues and purples and smoke everywhere. And I have to say that was one of those where I was a bit concerned, because again, in the chair, his whole body was shaking as he was describing that. And I'm going, oh my God, is he having a seizure or something? But he kept talking and describing what was happening. And he was fine afterwards, although he did say it probably took him 24 hours to completely reorientate. Now, he wasn't a patient. He was a friend of a friend who was really keen to do a regression. So I didn't catch up with him for a year. And a year later, when we spoke, he said, "John, you probably don't realise, but I've had asthma all my life. And ever since we've done that regression, my asthma's gone." And I caught up with Charles again just recently. So it's probably some 8 years since we did that, and his asthma has remained absent, resolved. So that's kind of lovely. And sometimes it's a dual benefit, a combination of the physical and the emotional. And a good example of that is Sandra. And Sandra, I'd seen her for many years, and she'd had difficulties always, ever since she was a child. She was concerned that she was going to be attacked, that someone was going to brutally attack her and do something dreadful. She in her house, her bedroom was up on the second floor, but she still felt that someone would climb up and get through the window and come in and attack her. So she didn't have an easy upbringing, I have to say, but it didn't make sense in terms of the extent to which she was fearful. And she was always seen as a difficult child as a consequence of that. Now, as it happened, she went back into a lifetime. And again, some of these are a bit traumatic for me. She went back into a lifetime where she was abducted when she was young, and she was forced into prostitution. And she even went to a memory where she was bound and raped. And again, for me, that was quite traumatic. Remarkably, afterwards for her, it didn't really faze her too much. Somehow, just the whole process of it happening back then, and giving her perspective on what was happening now. So she, that for her was really remarkable, because it helped to explain what her fears and phobias were in this life, and why she had always worried about being attacked and being forced into in some way, even as a child, that carried through into her adult life. The other interesting thing about Sandra was that she also had recurrent tonsillitis. She'd had tonsillitis all her life. I'm not sure why she hadn't had her tonsils out, but every month she'd have an attack of tonsillitis, quite severe, and it would take a week for it to resolve. And after we did that regression, the tonsillitis just resolved completely. And I'll leave you to join the dots between having a lifetime of forced prostitution and the tonsillitis. So, but that, it just had a wonderful effect, and that's been ongoing. I've obviously seen her a bit since then, but she's very much better. Now, lastly, and not least, I know we haven't got a lot of time. Is that for some patients, it's just when they go into that through the lifetime and then go into that spirit state after the lifetime, there's something just quite wonderful about that. And there's something loving and peaceful, and the experience, just as people do with their near-death experiences. And that experience often just stays with them and gives them a much more positive perspective on how they see themselves and others. And that also certainly applies to me. I thought I'd just give a quote to finish of Karen, who was a woman I saw last year, and she'd gone through a past life and then transitioned into that spirit state. And she said this, and I'll just quote. This is the transcript. She said, "I'm no longer restricted in a small body. I feel like I've expanded. I feel light. I keep thinking of forgiveness, of me and everyone. I feel like I can celebrate that life. I feel loved. The love is overwhelming. There are so many beings. The love is overwhelming. Everything is as it should be. No one is doing anything wrong. What we don't understand is that we are perfect as we are. I feel like it's so clear." Now, that was just really quite lovely, and not that different to some of the other patients who've had similar experiences. Now, I said that there's no downside, Perhaps in this case there was a very small downside, because it took Karen about 3 days to really reorientate back into her into being human again, as she put it. She said it was just so lovely. It's like she didn't want to come back. That experience was so profound, but she had to, and she was back dealing with the children and all her other issues. So I thought I'd finish on that note.